They work full-time, but still sleep in frozen cars. Kids miss school not because they're sick, but because they don't have a roof over their heads. This isn't a movie. This is Michigan in 2024. Michigan, the state that once stood as a symbol of American resilience and industrial pride, is now unraveling in silence. Its streets, blanketed in snow and legacy, are now littered with makeshift tents, shopping carts, and the haunting echo of survival. In cities like Detroit, Flint, and Grand Rapids, homelessness isn't hiding anymore. It's everywhere. Under bridges, behind gas stations, across frozen sidewalks. In this travel documentary from our channel, we take you beyond the beautiful lakes and tree-lined highways into the gritty heart of a crisis that too many choose not to see. Because this isn't just about poverty, it's about how the American dream is failing the very people who helped build it. Now, let's dive in. Current state of homelessness in Michigan. Michigan's point-in-time count for January 2024 recorded over 8,000 individuals experiencing homelessness across the state, the highest figure in nearly a decade. Detroit alone accounts for roughly 400 of those, with camps springing up along the Cass Corridor, beneath the Ambassador Bridge ramp, and in abandoned lots once intended for redevelopment. Grand Rapids reported nearly 900 people living on the streets or in emergency shelters, while Flint and Lansing each saw counts exceeding 600. Decorated veteran end up wrapped in a threadbare blanket under a highway overpass. These aren't sensational questions, they're the daily realities for many Michiganders. As we document these scenes in this travel documentary from our channel, the urgency is clear. Across town, outreach workers from a nonprofit are racing against the thermometer. Temperatures often dip below zero from December through February, and in the past 3 winters. At least 9 homeless individuals in Detroit have died from exposure. Every death is preventable, says James Carter, director of Streetlight Outreach. Yet our shelters are overwhelmed. And many people refuse to go inside for fear of crime or losing their spot in line. If you're moved by these stories, hit like, leave a comment, and subscribe to our channel. It helps us bring you real stories from the front lines. Despite the best efforts of volunteers and faith-based groups distributing hot meals and winter gear, the scale of the crisis outpaces available resources. Many shelters cap their intake at 200 beds, leaving hundreds to choose between freezing outside or facing overcrowded conditions inside. Children miss school because they're bouncing between cars or doubling up with relatives in cramped apartments. Elderly individuals with fixed incomes find themselves priced out of the most basic one-bedroom units. Every frame of this travel documentary seeks to bring you face-to-face with the people behind the statistics. From professionals in suits who became homeless after medical emergencies to teenagers who aged out of foster care with nowhere to go, Michigan's crisis is multifaceted. Statewide, about 30% of the homeless population are youth under 25, and nearly 20% are veterans who served their country. Poverty maps reveal stark disparities. Neighborhoods hardest hit by factory closures and redlining decades ago now register the highest density of unsheltered individuals. In economically depressed towns like Saginaw and Muskegon, local leaders report makeshift camps growing near industrial sites, places no one notices until something goes horribly wrong. Having seen the faces and figures behind this crisis, it's crucial to understand what drives so many people to the streets in the first place. Underlying causes of Michigan's homelessness. At the heart of Michigan's growing unhoused population lies a severe shortage of affordable housing. From 2020 to 2024, the average rent for a one-bedroom apartment rose by 30%, while the state's median wage increased by just 8%. Is there any wonder that someone working 2 minimum wage jobs still can't afford an apartment? How can someone hold down 2 jobs and still end up on the street? For many, the math doesn't add up. A full-time minimum wage worker in Michigan earns roughly $21,000 per year, far below the $29,520 annual income needed to rent a modest 2-bedroom home at fair market rates. When rent soars above 35% of one's income, eviction notices and doubling up become inevitable. Housing advocates point to the state's lagging construction of low-income units. Fewer than 500 new affordable homes went up in 2023, while demand grew by nearly 1,200 families. Compounding the crisis is the surge in investor-owned rentals, where short-term profits take precedence over long-term leases, driving rents even higher. Mental health challenges and substance use disorders also play a major role. Nearly 40% of Michigan's homeless population report serious mental illness or addiction issues. Over the last decade, state psychiatric facilities slashed capacity by 25% due to budget cuts, leaving many without a safe place for treatment. When public hospitals discharge patients without community support plans, some end up on the streets within days. The lack of structured reentry services for formerly incarcerated individuals further compounds the problem. Each year, more than 15,000 people are released from Michigan prisons. Yet fewer than half receive any form of transitional housing or job training. Without an address or stable job prospects, recidivism rises, and so does the likelihood of homelessness. Administrative barriers and social stigma create invisible walls. Requirement of identification documents, proof of income, or clean criminal records can prevent vulnerable individuals from accessing even basic shelters. I had to choose between staying clean and getting kicked out of my program, recalls David, a recovering addict. There was nowhere else to go, so I relapsed. Through interviews woven into this travel documentary narrative, we uncover how policy gaps allow these cycles to persist. Rapid rehousing programs exist on paper but lack the funding to support more than a fraction of applicants. Emergency assistance grants are capped at $1,000, barely enough to cover a single month's rent in most cities. By the end of the travel documentary, viewers are left to question what kind of society permits its most vulnerable to slip through the cracks. Is our system failing those who need help the most? In the next section, we'll explore Michigan's social safety nets in detail and why they continue to fall short, even as the crisis deepens. Social safety nets in Michigan. Michigan's social safety net is a patchwork of programs designed to catch those who fall through the cracks, but the holes in this net are glaring. Emergency shelters across Detroit, Grand Rapids, Flint, and Lansing offer a lifeline, yet capacity rarely meets demand. In Detroit alone, more than 60% of shelter beds were occupied by repeat visitors in 2024, leaving newcomers turned away on the coldest nights. Seasonal warming centers open during extreme weather, but they function more like triage stations than sustained solutions. Guests must leave by dawn, only to return when temperatures drop again. Housing choice vouchers, meant to subsidize rent for low-income households, carry years-long waiting lists. Despite state efforts to expedite placements, only 25% of eligible families receive assistance in any given year. Rapid rehousing programs aim to stabilize people in permanent housing, but funding gaps force many participants out of the program after just 6 months, even if they haven't regained economic footing. Faith-based organizations and nonprofits, like COTS and Southwest Solutions, fill some of the void, distributing blankets, hot meals, and bus tokens. Yet these groups depend on private donations and volunteers, making their services inherently unstable. Healthcare and social services struggle to coordinate. Case managers maintain caseloads exceeding 40 clients each, leaving little room for personalized support. Mental health outreach teams fall short of covering all encampments, and addiction treatment slots vanish within days of opening. Mobile clinics roam the streets, but without a stable address. Many unhoused Michiganders miss follow-up appointments and prescription renewals. Healthcare and social services struggle to coordinate. Case managers maintain caseloads exceeding 40 clients each, leaving little room for personalized support. Mental health outreach teams fall short of covering all encampments, and addiction treatment slots vanish within days of opening. Mobile clinics roam the streets, but without a stable address. Many unhoused Michiganders miss follow-up appointments and prescription renewals. Digital innovation offers some promise. An online portal launched in early 2025 allows providers to track bed availability in real time and coordinate referrals. But outdated hardware in community shelters and spotty cellular coverage in rural counties hamper its utility. Homelessness isn't confined to urban centers. Small towns like Alpena and Marquette report growing encampments near train yards and river walks. There, municipal resources stretch thin, and the safety net feels more like a single thread than a web. Government responses and policy measures. In response to mounting pressure, Michigan's leadership has rolled out a series of initiatives aimed at stemming the tide of homelessness. Governor Whitmer's 2023 to 2024 budget earmarked $250 million for affordable housing construction, shelter expansions, and rapid rehousing grants. Lawmakers passed bipartisan legislation to streamline zoning regulations, encouraging municipalities to approve accessory dwelling units and convert underutilized commercial spaces into living units. These policy shifts mark a crucial acknowledgement that housing is a human right, and that government must play a central role. Michigan cannot build its future on empty promises, the governor declared at a February press conference. We will unlock doors, not just windows of hope. Yet implementation has proven uneven. Detroit received the lion's share of funding, roughly $90 million, to rehabilitate abandoned buildings, while smaller cities saw only token allocations. Flint's City Council struggled to pass a housing bond with enough community support to build even 150 new affordable units. In Grand Rapids, bureaucratic delays sidelined a planned 200-bed shelter for months, forcing emergency services to stretch existing facilities beyond capacity. Statewide, the Housing First model has gained official endorsement. By prioritizing permanent housing over temporary fixes, Housing First flips the script. Individuals secure a lease and then access supportive services, from mental health counseling to employment training. Pilot programs in Washtenaw County reported a 45% reduction in emergency shelter stays among participants, demonstrating measurable success. But scaling these pilots to cover all 83 counties will require sustained funding and cross-agency cooperation. In addition to housing investments, Michigan lawmakers expanded Medicaid coverage for substance use treatment and mental health services. New mobile outreach teams hit the streets equipped with clinicians authorized to prescribe medication-assisted therapies for opioid use disorder. Meanwhile, the Department of Corrections unveiled a reentry housing voucher program for individuals leaving prison, aiming to curb recidivism and homelessness. But critics argue that voucher amounts, capped at $600 per month, fall short of rising market rents, leaving recipients at risk of eviction once their vouchers expire. Community policing strategies are also evolving. Instead of routine sweeps of encampments, some departments now partner with outreach workers to offer on-the-spot referrals to shelters and support services. This shift, designed to reduce criminalization of homelessness, has produced mixed results, with some residents still avoiding contact out of fear of citation or jail time. Are these commitments enough to meet growing needs? The uneven rollout of policies and funding disparities across regions suggest that, while promising on paper, government responses have yet to fully grapple with the scale of the crisis. To move beyond pilot projects and limited funding windows, Michigan must consider broader, more comprehensive reforms, which we'll examine in the following section. Comprehensive proposals for lasting change. No single solution can erase chronic homelessness in Michigan. Instead, experts recommend a multifaceted strategy that weaves together housing, healthcare, economic opportunity, and community engagement. First, the state should adopt a permanent supportive housing model at scale, pairing deeply affordable units with wraparound services on-site. Research shows that every dollar invested in permanent supportive housing saves at least $1.50 in reduced emergency healthcare, criminal justice, and shelter costs. Next, Michigan must expand income supports. Raising the state's minimum wage to match housing costs, ideally linked to a percentage of median rent, would empower more workers to afford basic shelter. Introducing a state-level earned income tax credit could cushion families against income volatility and sudden job loss. Such financial scaffolding reduces the risk of eviction in the first place. Policymakers should incentivize private sector participation. Offering tax credits or low-interest loans to developers who allocate 20% of new projects to affordable housing can unlock millions of dollars in private capital. Corporate social responsibility programs might partner with local nonprofits to provide job training specifically for unhoused individuals, creating pathways out of poverty and homelessness. Besides, investments in preventative measures are crucial. Schools and hospitals should screen for housing instability, referring families to case management before eviction occurs. Mandatory no-wrong-door policies would ensure that anyone presenting at any state agency, whether for healthcare, social services, or legal aid, receives an immediate housing stability assessment and referral. A unified data system must track every person experiencing homelessness across agencies and regions. This real-time dashboard, powered by secure cloud technology, would alert outreach teams to individuals at high risk based on factors like repeated shelter requests, severe health issues, or frostbite reports. By predicting crises before they escalate, Michigan can target resources where they're needed most. Community engagement remains a cornerstone. Local coalitions of residents, businesses, faith groups, and service providers can organize block-level efforts, cleaning encampment sites, delivering mobile services, and advocating for neighborhood-based supportive housing. Such grassroots involvement not only fills service gaps but also reduces NIMBY opposition by fostering personal connections. Who will hold policymakers accountable when winter strikes again? Implementing these comprehensive proposals demands political courage, sustained budgets, and cross-sector collaboration, qualities that only emerge when public sentiment and political will converge. As this travel documentary narrative has shown, Michigan's homelessness crisis is not inevitable. It's a symptom of choices made and postponed. Real change requires confronting uncomfortable truths and investing boldly in human dignity. Conclusion. Michigan stands at a crossroads. The state can continue patching a worn safety net, watching as more families, veterans, and children slip through. Or it can choose a path of bold innovation and collaboration. By scaling permanent supportive housing, bolstering income supports, leveraging private partnerships, prioritizing prevention, and harnessing data-driven interventions, Michigan can transform its approach from reactive to proactive. This journey will not be easy, but the stakes are nothing less than the state's moral and economic future. Every family stabilized is a testament to policy done right, and every dollar saved in emergency services justifies the upfront investment. As our channel concludes this travel documentary exploration, we leave you with a final question. If not now, when will we commit to ending homelessness in one of America's heartland states?